Matthew Holt, another THCV Spotlight. I'm here with Tom Knight. Tom has a long background in data technology and other areas, most particularly for many years around a company called Investix, which ended up as part of Wolters Kluwer. Not unrelated to what we're going to talk about now. Um, Tom is now, these days, he has his own business called Optinosis, but he's appearing here because he's the chairman of a non-profit called Healthcare Diversion or healthcare, you can find on the web at healthcarediversion.org. Tom, thanks for joining me. First up, what the hell is healthcare diversion? And we're talking here about mostly medication diversion. And I think we've probably all heard stories about this, but tell us what it is and give us, tell us what the problem is.
Yeah, thanks, Matthew. So, drug diversion in healthcare facilities is when someone is stealing drugs, someone who's working there or in the facility. And it happens all too often. Our nonprofit's mission is to reduce how much drug diversion happens in healthcare.
So give me a sense about what we're talking about. What I assume most people think about this, and we'll probably get to a couple of cases later. Most people think about this as people who are healthcare employees who are addicted and are taking drugs and then either not replacing them or replacing them with something else. But it's not, it's that, but it's more. So give me a sense about the flavors of what's going on.
Sure, sure. Well, most of the time people talk about drug diversion, it's done by people who are working in the facility, nurses, doctors, other clinicians like pharmacists. And they're usually stealing the drugs to take themselves. For whatever reason. They may have developed a substance use disorder and they need them to avoid withdrawal, or there might be some other cycle of abuse. And they have a whole variety of ways that they can steal the drugs, which we can talk about. The challenge, of course, is people who are stealing drugs will do anything they can to get those drugs and to cover up their theft. And that's why it's a difficult problem to address, but it's one with a lot of victims that we could talk about and a lot of risk.
Right. But it's not just that, right? There's also other types of diversion.
Well, we focus on drug diversion, but there are other types of diversion where people are doing Medicare fraud or they're
Right.
diverting patients to different hospitals. But we focus on that definition of drug diversion.
Okay. So let's talk a bit about what you're trying to do. Well, before we get that, give me a sense of the scale of the problem. When we talked before, you have some statistics which I thought were fairly alarming. So give me a sense of the scale of the problem.
Yeah, there's been quite a bit of research done to estimate how often drugs are diverted. And the best statistic is roughly 1 in 10 healthcare clinicians will divert drugs at some point in their career. The numbers are actually probably higher than 10% for some types of healthcare professionals, like anesthesiologists, for example. Um, but on average, over the course of a clinician's career, roughly 1 in 10 will divert drugs at some point.
I mean, that's a huge number given how many clinicians there are in America and, the impact down the road of, if 1 in 10 people is diverting, especially controlled substances and they're not available. I mean, it's
Yeah,
incredible,
you just think
incredibly
about
important.
a typical size hospital might have 300 beds or so. That's about 1,000 nurses. So 10% of 1,000 is 100 nurses over the course of their career will be diverting. Some of them, in many cases, for years before their diversion stops or they're detected.
So this is a huge problem. It's flared up in the news from time to time. We'll touch on a couple of those cases, but it probably doesn't get that much publicity compared to the scale of the problem. And so tell me what healthcarediversion.org is and what you're trying to do about it.
Sure. Well, part of why we started the nonprofit is to raise awareness of just how big this problem is. Most people aren't aware of how often drug diversion happens or its many victims. So we started this nonprofit to raise that awareness and to hopefully reduce through best practices and reporting and awareness the amount of diversion that happens.
And in your prior career in Investix and Wallace Kluwer, what you were associated with the sort of same issue. So what was that company doing? What was the technology involved there to help this problem?
Yeah, that was a company I started called Invistix Corporation, and we had software that tracked inventory, including medications, across the supply chain. And what we discovered is it was really good at detecting when people divert drugs because it was tracking all the handoffs of the drug, starting from when it was purchased by a hospital and then delivered into different care areas and eventually administered to a patient. And that software we found was really good at taking data hospitals already have like electronic health record data, and detecting when people in that facility are stealing drugs. So that's how I really got exposed to drug diversion. I didn't know about the field until our software was able to detect the diversion. And the more I learned about it, the more I realized that most drug diversion goes undetected. And technology like this could be a part of what we could use to reduce the amount of drug diversion. So as I was talking to various stakeholders, both on the private side and the public side, it occurred to me the best software in the world is not going to be useful if people aren't trying to prevent diversion or investing in technologies like ours to detect the diversion. And that's when particularly public stakeholders, like people I knew at the Centers for Disease Control, said, what we really need is a public-private partnership that could bring innovative private technology and leading healthcare organizations to the table alongside of the public organizations like the CDC or law enforcement or licensure boards at the state level, so that collectively we could have a shared perspective of the problem and come up with best solutions possible to reduce it.
All right. Well, show me a little. You've got the. Why don't you dig up the website? Drag up the website for healthcaredivision.org and show me a bit about what's on it. And then you've also built a database of basically of criminal activity, for want of a better word. So show me what you've built together and tell me, give us a little bit of a tour here.
Sure, sure. So hopefully you're seeing my screen.
Yep.
So welcome anybody listening to visit our website at healthcarediversion.org. This is your homepage, our homepage, and describes our mission as a 501c3 public-private partnership. You mentioned, Matthew, criminal activity. I do want to point out that many of the people who are diverting are themselves victims of
Sure.
diversion. They never hoped to become addicted or develop a substance use disorder when they started diverting. So we tend to think of them as victims of diversion. When you're taking these controlled substances, your brain chemistry changes. It's very, very difficult to avoid finding the next dose. And so you'll see that
Absolutely. I
throughout
mean,
our
I
messaging.
think, criminal activity I mean, it is a crime. Clearly, what is being committed in most cases. However, obviously there are ways of treating and dealing with people in this situation. I'm not trying to say that I'm a big one for the reform of how we treat people with substance use disorders in this country. Having said that, you are there are many incidents to this that you've written about. So show us a bit about this.
Sure. So currently we have 684 incidents in our database. You'll see those in a second on a map. And you can see we're all about collaborating, raising awareness, educating on best practices, and hopefully preventing diversion in the future. Um, uh, in our database, you can actually search by different types of clinicians, pharmacists, nurses, et cetera. And you can also drill down into different types of diversion like tampering. And on our website, I'll show you in a second, you can also report an incident. If you're aware of an incident that's not in our database, we encourage you to report that. And I'll talk about how that is received inside the website and then potentially published. I do want to give a quick shout out to our advisory board. We owe a lot to the folks on our advisory board. I mentioned earlier, we're a public-private partnership. And if you visit this page on our advisory board, you'll see we've got people on the public side, like representatives from the Office of the Indiana Attorney General, the private side, like retired executives from hospitals and health systems, or people that are working in leading healthcare organizations trying to reduce diversion. And we've got dozens of these people that over the years have given us great perspective on how we can come together and reduce drug diversion. So on to the incidents. I mentioned earlier, you can report an incident on our website. We have many volunteers that report incidents to us. They find them through a variety of sources. Could be a local news channel, nurse caught stealing drugs at county medical. Could be a report of somebody who's been convicted at the state or federal level. Or it could be somebody working in a healthcare facility and maybe they've told management and nothing's been done about it. So they can report it to us. And in some jurisdictions and for some types of diversion, we'll forward that to the appropriate folks on the law enforcement or licensure side for investigation. And this is the form they can fill out to tell us what they know about the diversion and including any public sources that are available. We'll only publish something that's been reported if we can verify it with a trusted third party. And even if we can verify it, if someone's been accused, say, but not convicted or found to be worthy of discipline from an administrative review, we'll de-identify the names from someone if, say, they're accused but not yet convicted. So that's where the reports come from, the volunteers we have around the country, as well as people that are reporting on our website anonymously. And after it's all been reported and scrubbed and verified, de-identified as necessary, that's how you can see it in our database. Here's a map of the US, and we have 600 plus incidents, at least one from every state, and quite a few coming from international locations as well.
So
Uh,
let me guess. I mean, 600 incidents sounds like a lot, but if it's one in 10 of every clinician, there's thousands of thousands we don't hear. And obviously, some of them you don't know, never happen, but there are presumably others that for whatever reason are not reported. Is there any other systematic system of reporting this kind of stuff? You know?
uh, yeah, well, 2 points there. Number one, our hundreds is just a tiny, tiny drop in the bucket or the ocean, so to speak. As I mentioned earlier, most diversion goes undetected, so it's not known at all. In fact, sadly, many cases that are detected are not reported as they should be. If a hospital detects diversion, they're required by law to report that, but many don't. For whatever reason, maybe they're embarrassed, maybe they want to avoid the publicity. So only the
It's a
ones that
bit
are
like
reported.
accounting firms not reporting fraud, right? You don't want to hear about it until it becomes Enron, right?
Yes, yes. And then even those that are reported, our database only has a tiny fraction of. Uh, and
When you say reporting it, may report it to licensing boards or local law enforcement or whatever. There's no other national way of sort of sucking this data up.
that's right. It's really uh, run by states or
Yeah.
local public health authorities. There are types of diversion that are investigated at the federal level. A great example are tampering cases. That's where someone takes the medication and replaces it with something else, like putting tap water in and where the fentanyl used to be. And since the Tylenol poisonings years ago, the Food and Drug Administration has law enforcement investigators that will investigate tampering cases. But if it's non-tampering, it's almost always investigated at the state level by, say, an appropriate licensure board of nursing, pharmacy, medical board.
And who knows what the FDA will be getting up to after they fired half their staff, whatever they're doing this week. We'll move
Yeah.
on.
Yeah.
Right.
And I'm not aware if cuts have impacted the Food and Drug Administration's Office of Criminal Investigation, but that's the only group that's handling diversion of tampering. And I should also mention the DEA is
Yeah.
also responsible for enforcing the Federal Controlled Substances Act. So they'll often get involved when diversion is happening for controlled substances.
Right. Right. So do you
So
want to
yeah,
dive in and show us some examples from the map?
yeah. So a couple that I think are relevant. Some of your viewers might have heard of a really uh, recent case that was in Connecticut at Yale New Haven reproductive case. This was a nurse who pled guilty to tampering with fentanyl vials, and it led to a podcast I think even you've seen explaining what happened to these patients. They went in for procedures. I think it was egg collection as part of reproductive procedures. And instead of getting the fentanyl that would be necessary for that procedure, they got um, water. And some of them even woke up during the procedure and told the clinicians they were in pain, and people didn't believe them. So this is an example just to illustrate how this works on our website. You can not only see all the reports on the map, you can even see whether patient lawsuits, were there patient infections, patient deaths based on the symbol inside of the dot on the map. And orange are healthcare facilities that are not hospitals. Red are healthcare facilities that are hospitals. And of course, we can click to drill down and see more details on this case. And it's going to pull up what our database knows about it and also links to third-party websites that we can see. So here's the headline: nurse admits stealing fentanyl at 2 clinics, patients sue. You can see the type of facility. if the person's been convicted criminally or disciplined by a licensure board, we will put their name on there if it's verifiable through trustworthy third parties. And we'll also even put publicly available news reports about the incident. So that group I mentioned from the FDA, they have a press release on their website when the person pleaded guilty to doing this diversion. Here's the sentencing for that nurse. They were sentenced to years in prison. And there's also public available news reports about that incident. So that's the kind of information that we provide for any one incident that's in the database. Any questions on that first example?
Yeah, no, I mean, we'll talk about this in more general terms, but as you mentioned, there's a lawsuit involved in this one, right? Which, and we'll get to this, but there are real, not just consequences for the one time they get caught, but there are consequences for the organization for not having this under control. And we'll talk about, I think you'll show me a couple more examples so we can talk a bit more about what organizations can do and why they should do it. So let's we'll shelve that. But I mean, this case obviously got a lot of publicity. It was an NPR series of podcasts about it. But, literally it was women waking up in the middle of, having their eggs harvested in unimaginable pain and being told, no, they're there, you're making it up. And it took, I think, a number of them to sort of get together just to all complain at the same time before somebody went and figured out what was going on. And then obviously you have a lawsuit, which, well, Yale has a big endowment, so it can afford the lawsuit. Okay, I'm kidding. But show us
Yeah,
this Oregon case that is pretty interesting.
sure. So another case you see has this symbol in Medford, Oregon. This is really tragic. Here, patients were actually killed as a result of drug diversion. At least two have been killed because a nurse replaced fentanyl with unsterile tap water, and then that was infused into the patients. And that's resulted in many lawsuits, at least $1 million sought in damages. Um, and it's really tragic because the number of patients injured or killed is probably higher than what's known. And of course, this is horrific
And
for the
these
patients. It's also
you,
horrific for the institution where the
and these
diversion
patients
happened.
presumably died of an infection or something. If you got dirty tap water or
Yeah, that's
like that.
exactly right.
Yeah.
Uh, and these were found after the families um, were informed that they died of infection, but it took quite a while to understand where the infection had happened, what had been the root cause, and it was a single nurse who was working at this particular regional medical center that was diverting in a particularly dangerous way, and it led to patients dying.
Yeah, I mean, and that's just obviously a tragic thing that happens, number one, and also number two, it's hard to figure out because you've got, there are obviously hospital infections and hospital acquired illnesses and what have you, which happen in the course of hospitals, and there's a whole patient safety movement completely irrelevant, irrespective of the drug diversion issue, it's working on that, and it hasn't, and we still have one of those issues. So to figure it out was actually probably pretty hard.
Yeah, and I've actually worked on our advisory board. We have the folks that figure out the cause of these infections from the Centers for Disease Control. And it's a pattern, sadly, that's repeated in many places.
Right.
Sometimes one clinician will work in multiple facilities and injure patients along the way.
Do,
Or in
do you
fact,
know do you know in this case or other cases how they actually tracked it compared to any other type of infection, a fatal infection, not even sepsis or whatever that came from something else? Do you
yeah,
know
I'm
how
not familiar with this case, but I know the specifics of other cases.
Yeah,
Like the person diverting might have a bloodborne disease like hepatitis C,
yeah.
and they're actually able to match the virus that's infecting the patients and see that they all came from a single strain of the virus. And then they'll collect samples from the people who might be diverting, and they can tell that the virus matches the person diverting. The virus is the same as the person who was infected by the diverting.
Well, it's like the cold cases you hear about on the true crime podcasts where you're trying to track down the DNA from a bunch of people who were in the area with the original suspect. Incredible. Fantastic. But there's another case as well you want to show me. So when you could go to that one.
Yeah, one other. I think those two cases are good examples, sad examples of what can happen with tampering, where someone's diverting for their own use. Diversion also happens for profit. In my hometown of Atlanta, there was a particularly challenging case that over the course of 5 years, two pharmacy technicians stole more than 2 million doses from an Emory hospital in downtown Atlanta. These folks were doing it entirely for profit. There was one person in the offices that was ordering, and a second person was receiving those on the receiving dock. But instead of stocking them into the hospital, they wheeled them out to their car, and it was distributed through organized crime throughout the Southeast. Codeine, cough medicine, Xanax, hydrocodone tablets. And it was several years before the technicians were detected. So this is a type of diversion that's particularly sad because it leads to, these drugs being available in our communities, which leads to untold tragedies and addiction and overdoses. And it's done for profit,
Sure.
and particularly um, uh, tragic when people are stealing these quantities of drugs.
So, I mean, you got to ask, right? And this is back, and we can probably, and if we're ready to move on to the sort of wider conversation, in you've got tracking people down via strains of hepatitis B, but in this case, 2 million doses of these different medications disappearing from the hospital which should have been there. What kind of controls? And you've talked about looking at medical records and seeing, finding people with infections and what have you to try and understand where there might be diversion in the system where it looks like drugs aren't being effective or whatever. But what kind of for something like this, which you'd think would be in a sort of supply chain management system, what kind of controls were going on here, and how did it take 5 years for this to be discovered?
Yeah, and I wasn't involved with this hospital at the
Yeah,
time, but there was
but you can surmise,
yeah,
right?
there was a lack of accounting controls to
Right.
confirm that what was being paid on invoices from the wholesaler had in fact been received into the hospital. To the credit of the accounting department, they put in a new accounting system, and that's what eventually caused this theft to be detected. But it had been going on for 5 years before that system was put in place, and it went on undetected that long.
So, I mean, essentially, they'd had, they paid for medication that, or they hadn't, or they either had or hadn't paid for medication, or hadn't filled in the forms as paying for medication, just didn't show up on the shelves. It didn't show up in the pharmacy machines and the Pixel machines and those kinds of stuff. And it just took them 5 years before they noticed there was this discrepancy. I mean, I don't know. You hear that story of the employee of the Jacksonville Jaguars who ran up a $20 million gambling debt by, fiddling his expenses. You understand that there are controls. I just heard Elon Musk this morning explaining how the federal government, couldn't pass an audit, and then the Financial Times is saying that, well, hang on, Tesla seems to have lost 1.5 billion off its books. So we know this problem happens at a big scale in big private and public organizations as well. But you think that how much do you think of this type of diversion for profit is going on compared to the personal use?
Yeah, great question. My experience has been most cases of diversion are done for self-use,
Yeah.
or occasionally maybe someone has a loved one who needs that medication, and they can't buy it, so they steal it. Um, but what I've also found is, in a small number of cases, people who are stealing from profit can steal incredibly large quantities before they're detected. And So what I found is when I look at the total volume of drugs diverted, it's probably majority for resale. But if you look at the majority of incidents of
Yeah.
diversion, it's majority for self-use.
Yeah, that makes a lot of sense. Absolutely. All right, wonderful. So this database you can report into. It's for free on your website. You can go look at it. Why don't we close the demo for a second and talk a bit about a couple of things. So we mentioned before in the Yale case, this big lawsuit, and I think the Oregon case as well, the big lawsuit. So that's sort of one reason I think why hospital health systems should be getting worried about this. How worried are they? You looked at this one, yeah. Where does this get on the radar screen of the senior officials, in the C-suite of these hospitals? Are people really thinking about this, or is this like, oh, well, it's lucky it only happens over in that hospital, even though you're saying it's actually going on everywhere?
Yeah, fair question. I think there's a range of maturity when it comes to this issue among hospital leaderships. I've worked with some teams that are incredibly proactive. They understand not only the risk to their organization, but to their coworkers and their patients. And so they'll hire people on staff to try and reduce diversion, detect diversion. They'll invest in technologies and such. And I'll give them credit for being proactive. In many cases, they're that way because they're aware maybe of a prior diversion that happened either on their watch or at their institution or maybe somewhere they used to work. But those are, I will say that the fraction of people that I see leading health organizations that are in that category is going up.
That's
In the
good.
7 or 8 years that I've been in this field, I think awareness is growing. The penalties associated with failing to stop diversion are growing. Not only the lawsuits that we've talked a lot about, but organizations like the DEA will issue fines, multi-million dollar fines that are often record highs because that's how the DEA gets headlines and changes behavior.
Right.
Um, so as a result, I think also our nation's opioid epidemic, overdose epidemic, has raised awareness that we need to take better control of these kind of medications. So long story short, I'm seeing more and more leaders in these organizations doing the right thing to try and reduce diversion or detect it if it's happening. But sadly, it's not every leadership team still. I still see leadership teams that are just hoping it doesn't happen on their watch. Or even worse, they're saying, well, it would never happen here. Our people would never divert when their people are just like anybody else's people in terms
Sure.
of the risks and the dangers of being around these drugs. So that's part of why we're so active with our nonprofit is to raise awareness that you have to be vigilant, you've got to be proactive. Otherwise, it's going to happen. It's going to damage your reputation. It's going to hurt your coworkers, hurt your patients.
Yeah, and let's not forget that for those historians in the crowd, the father of the father of modern surgery in this country, Halsted, right, managed to hide the fact he was a morphine addict his entire career till after he was dead. So and I suspect this is going on. We hear all about functional addicts, and I'm sure there's a lot of this going on amongst people who are you would never suspect it from, and we know that addiction and substance use disorder doesn't respect intelligence, qualifications, ethnic boundaries, gender. It's everywhere, right? So what? Give me two things. Like, it's a big threat out there. It's the awareness is growing, but it's not. I mean, I don't know if you give it a scale of 1 to 10 on the awareness. So we had a 2, or we had a 5, or
When I
some of it
when
not
I
in the 10.
when I started, maybe 1 out of 5 hospitals were really taking this seriously, and I
Yeah.
think the number's closer to 4 out of 5 now.
Oh, okay, so we're heading to 70, 80%. And then what can hospitals do? We talked a bit about your earlier company, which is now part of Walter's Kluwer that works in this. But what I mean, is this a supply control? Is this investigation of the fact? Is better monitoring of using, I don't know, video and AI of people in pharmacies? What are the kinds of things that are you're going to start to see more of to deal with this issue?
We're seeing more hospitals invest in education of their staff of how common this is,
Right.
and why, if it's happening, you're helping this person by reporting it so they can
Cool.
get the help they need with their substance use disorder. So I put that in the category of preventative measures. Um, you're also seeing hospitals that are investing in detecting diversion that might be going on in their facility. And that can mean someone working part-time or full-time to try and detect diversion. That could mean investing in the kind of software that Wolters Kluwer now provides that was originally developed at the company I sold to them a few years ago. Um, um, so those are the two categories, prevention and detection. Because we always said if you're not finding diversion in your facility, it's because you're not looking for it.
Right. Is the move towards these I was reading about the an interesting article about the Vegas mass shooting, and not obviously to do with diversion, but in this case, they needed so much stuff so quickly they couldn't have time to get the Pyxis machines and the other storage devices open, so they were just. But in general, most hospitals now have got a tracking system of pharmacy. How, how much of sort of surveillance of that and monitoring of that is just the data's there and people haven't looked at it, or are people getting around it, or are we having to do more monitoring over the top of those kinds of systems that are already there on this sort of detection part?
Yeah, that's a great question. What we found over the years is each time there's technology to reduce diversion, like Pyxis machines that are now broadly adopted,
Right.
or their competitors from Omnicell.
Yep. Yep.
People who need or want to divert will find a path around that technology.
This is like kids like getting away from this, the parental restrictions on websites and phones. Somehow they figure out a way to be on YouTube.
It is, the drugs are locked up in the Pyxis machine, but I can dispense that drug and claim to have given it to my patient when in fact I pocketed it.
Yeah.
Even going to the point of falsifying the electronic health record to show I gave the patient the medication. Or the tampering cases are good examples of how you can get around the Pyxis machine.
So, I mean, there's obviously stuff that goes on. I suspect, I mean, I've seen many, many more, and I don't know if this is connected yet. I've seen many more hospitals now starting to use video and AI monitoring of patient activity. And, I assume it's going to, in general, staff are going to have to assume more surveillance of their activity, especially if it's this diversion issue is widespread as you're thinking about. Plus, staff are being surveilled for a bunch of other reasons, including, staff safety and also, workflow stuff, and even the basics of trying to figure out where the hell that wheelchair is, right? You're starting, there's a bunch more work going on within healthcare facilities to try to figure out, be up there on the mechanics. And obviously, as computer and AI, operation stuff gets more sophisticated, you'd assume this gets involved. So with that as a background, what is the future for your organization? You're not a very large nonprofit. I don't see you with the the multi-billion-dollar endowment, all the rest of it. But tell me a bit about how you're getting funded and how you think that your particular nonprofit healthcare diversion can actually help in this overall manner.
Yeah, we are volunteers and we do things quite on a low budget. But what's been exciting is we have started to influence not only behavior in these organizations, the healthcare organizations that I mentioned, but we're also starting to see potential changes on the public policy side. We're working with organizations that are drafting what's called a model state drug law to prevent drug diversion in healthcare. Um, because as I mentioned, this is largely run by the states,
Right.
like licensure boards. And some states are leaders in certain areas. Others are laggards. And so what we're trying to do is publish the right set of model laws that states could follow and adopt so that they're more likely to address this problem in the correct ways. For example, providing paths for clinicians to come forward and admit diversion and hopefully get help with their substance use disorder before they hurt themselves or their patients. So that's probably the biggest area that I'm optimistic our nonprofit can help with as a public-private partnership. We're seeing that our country in certain states does better. And how can we spread those best practices on the public side? And how can we spread those best practices on the private side as well?
Fantastic. So if you're in a hospital or a health system, or you're just seeing this and you're interested in getting involved and supporting or figuring out how this works, what are the ways that one could get involved?
Yeah, so you can learn a lot from our website. There's also great nonprofits that we support in this field too. In particular, I'll mention one is the National Association of Drug Diversion Investigators, NADI, and they hold a conference every year on this topic. And similarly, there's another nonprofit we support called the International Healthcare Facility Association, IHFDA, and they also host an annual conference. And their website also has great information you can learn more about.
And I assume people can track you down, and if you're happy to talk more about this topic, I hope.
Absolutely. There's a contact us form on our website. We welcome suggestions. We're always looking for volunteers to support us.
All right, brilliant. So I've been talking with Tom Knight. He is the founder chairman of healthcarediversion.org, which is shining a spotlight on that interesting and probably not talked about enough issue of drug diversion in hospitals and healthcare facilities. Hey, Tom, thank you very much for your time.
Thank you.